Good evening to all our viewers. This is your host, Dr. Anjana, for this evening. Today we have with us an international speaker, Mr. Michael Joshua. His journey is a testament to compassion, innovation, and dedication. With over 7 years of nursing experience in Nigeria, he has developed a deep understanding of the critical importance of accessible healthcare. His passion for making a broader impact led him to co found Mikul Health, a health tech company that democratizes healthcare by providing a platform for accessible nursing home care services. In addition to healthcare work, Michael became a software engineer as well, blending his medical expertise with technology to address healthcare challenges effectively. This unique skill set has been instrumental in Mikul Health's success. In 2021, recognizing the dire need for free medical care among underserved populations, Michael founded Rophe Global. Under his leadership, Rophe Global has provided vital medical services and charitable support to those in need. So, without further ado, let us welcome this multifaceted personality, Mr. Michael Joshua, for today's podcast session. Mr. Michael, welcome for this session, and we are great to have you here today.
Thank you very much, Dr. Anjana. It's a pleasure. I'm really honored to speak to you guys, and thank you for extending your invitation to me. I
Yeah,
appreciate it.
thank you. And the pleasure is all ours to have you today here. And Mr. Michael will be sharing, his journey about how he entered the nursing field and his experiences in nursing, and then how he entered the healthcare entrepreneurship. And he will be speaking about his entrepreneurial journey as well today. So let us start with your nursing journey, Mr. Michael.
Thank you
So
very
here
much.
yeah, looking back on your career, so what are the biggest changes that you have witnessed in the nursing field? I mean, from when you started to now, what are the biggest changes you have seen?
Thank you very much. You know, looking back over 7 years, I kind of this question I consider it a bit tricky because at first like I have to match all that I've experienced in this answer, right? However, one or two or three significant thing that I've seen is the changes around advancement in technology and their integration in healthcare.
Right.
From electronic health records to telemedicine, these innovations have revolutionized patient care and it has also
Hmm.
streamlined processes. Additionally, there has been a growing emphasis on continuous education and specialization within nursing, which has
Right.
enhanced the quality of care provided to patients. Thank
Hmm.
you.
Yeah. Okay. Now that you mention about enhancement of technology and all that, so what do you think are the important skills or knowledge that are most important for the nurses today that they need to have and they need to develop?
Okay, thank you. I mean, today, nurses must possess a combination of technical and emotional intelligence.
Hmm.
There should be an interplay of the two. I would
Hmm.
say there should be a marriage of the two. Proficiency in using healthcare technology and understanding patient data, staying
Hmm.
updated with medical advancements are crucial.
Right.
Alongside communication skills, empathy, and the ability to work effectively in multidisciplinary team. These
Hmm.
skills ensure comprehensive and compassionate patient care. Yeah.
Right, right. I completely agree here where you mentioned that, it is a multidisciplinary team. I mean, I think medical field is such that, you need to work along with the entire team, and you cannot work independently. And nurses are no different, right? Yeah.
Yes.
In your case, have you encountered any particularly challenging situation, that shaped your perspective on healthcare during your practice?
Yeah. I think this is one of the tricky questions too because if you know Nigeria very well, I mean, one of the things they taught us back in school was
Hmm.
the ability to improvise. Now,
Correct.
when you hear improvise, now you begin to think or you know that, okay, there might be situations where the ideal equipment or the ideal thing might not be available. Now you have to
Hmm.
improvise, right? So,
Hmm.
one particular challenging situation involved managing a critical patient during a shortage of essential medical supply.
Hmm.
This experience underscored the importance of resourcefulness and
Correct.
adaptability in healthcare. It
Hmm.
also highlighted the systemic issues we have within the healthcare system. Now, I don't know
Hmm.
if this is peculiar to Africa or
Hmm.
Nigeria as we speak, but I know
Hmm.
we kind of have some similarities between Nigeria and India. So,
Hmm.
this is really one of the things that I've experienced. Yeah,
Right.
and
I mean,
furthermore,
yeah,
this
please.
also
Uh,
drive my passion to seeking
hmm.
innovative solutions through
Hmm.
entrepreneurship.
Right, right, right. No, here I too agree when you say that there are similarities between Nigeria and India because, even in India, definitely Tier 1 cities have no issues, and majority of the critical care is accessible to everyone. But when it comes to Tier 2 and Tier 3 cities, I think they have to manage with whatever resources are available to them,
Mm-hmm.
right? And that becomes a challenge, and that is how as you said, in here also there is, they try to manage with whatever resources are available to them, and definitely that is one part where a lot of medical graduates are working towards. And I think even the government is trying to push medical graduates to work in tier 2 and tier 3 cities there.
Okay, great,
Yeah,
great.
yeah,
That makes the two of us.
yeah. So now moving on to the most rewarding experiences. So, what are the rewarding experiences you've had as a nurse?
Now this feels like, can we skip to the good part? Okay.
Yeah.
Um, well, the most rewarding experience in my nursing career came from making a tangible difference in patients' life. Now, I like saying that this literally makes me feel, gives me the God feeling, the
Hmm.
ability to be of help or the ability to contribute in the healing process. I
Hmm.
remember witnessing a patient's recovery, providing comfort during the difficult times, and receiving a heartfelt gratitude from the family. All of these
Hmm.
are really, like I would say, incredibly fulfilling for me. These
Hmm.
moments also reinforce my profound impact in healthcare professionals. Like,
Right.
I feel like not just me, rather I
Hmm.
feel like it is the entire healthcare professionals, right? Our impact and our place in the society.
Hmm.
Thank you.
Yeah. So definitely, I mean, I think all medical graduates, they feel blessed when they receive that gratitude from the patients and their families, and that is
Yes.
something that which is unmatched, right?
Yes.
Yeah, yeah. So, what do you feel, are some of the biggest unmet needs that you've observed over the years working with patients?
Hmm. Well, when you say the biggest I would say the unmet needs, right? There are a lot,
Hmm, hmm,
a lot, right? So,
hmm,
um, I'm trying to put them together, right? So, one of them to me will include the access to affordable healthcare.
hmm,
Access. So when you hear this, you can hear me say access and you can hear me say affordability, right? So
hmm,
especially in underserved communities, and the
hmm,
availability of comprehensive healthcare service. I like to
hmm,
think that the healthcare system, especially in Africa and Nigeria, we speak, is quite fragmented. Now, you can
hmm,
imagine having to come to a hospital and then you have to, do the basic thing you have to do. But when it's time for x ray or CT scan, you have to go to
hmm.
another place. So you
Right.
see it's
Hmm,
really, really fragmented. So I would say
hmm,
availability of comprehensive healthcare service.
hmm,
This also
hmm,
is there's also a critical need for better health education,
correct.
awareness, and
Hmm.
preventive
Hmm.
care initiative. So far we have always been on the damage control side of things, right? So there should be more health education, there should be more
Hmm.
awareness on the need for preventive health care, right?
Hmm. Right. Okay. When you speak about preventive healthcare, definitely, even in India, there are a lot of things that still needs to be done, right? Do you feel that there is some difference? I mean, compared to when you started off in your nursing career to now in the preventive healthcare, has there been some work done in Nigeria?
Well, there's a lot actually.
Hmm.
When I think of this, I begin to think of I would say, give me a second.
Yeah.
I would say
Uh, Mr.
sorry,
Michael, am I
my
audible?
network was hanging for a bit, so
Yeah,
I
I
wasn't
can
sure
hear
if
you
you
now.
hear me.
Please
Can you hear
continue.
me?
Yes, yes,
Yes, I
please
can hear you.
continue.
Can you hear me? Okay, thank you very much. So when you ask about preventive health care back when I started and right now, I would say yes, there is hope,
Hmm.
especially because I've seen the way
Hmm.
there are. I don't know if it's only in my space, but there has really been some emphasis on preventive health care, especially with what
Hmm.
we eat and especially in our lifestyle. So now you see
Hmm.
people aiming to, adding going to the gym, adding a couple of things to exercise in their routine, in their lifestyle. Now, all of these are, initiatives we can put in place for preventive healthcare.
Hmm.
So now you see people talking about eating healthy, getting smoothies, eating light, eating veggies, and stuff like that. So
Hmm.
yeah, I would say somehow we are getting there, but there's still much to be done. But we are no
Definitely,
longer where we
definitely.
used to be. Yeah.
Right, right. Definitely, as you mentioned, that lifestyle modification that we see in people
Mhm.
has been there, and there is a shift towards lifestyle modification as well here in India. And I think,
Mhm.
especially post COVID, this has caught up in a big way. Is it the same case in Nigeria as well? I mean, post COVID, people have become more aware, and is it something to do with COVID?
Well, if there's anything that COVID brought was the relevance of technology, right?
Hmm.
In the place
Right.
of healthcare, even in the access and delivery of healthcare. So there is a
Hmm.
huge place of technology now. So now the major thing I think that COVID brought was the introduction and the relevance of telemedicine. So you see
Hmm.
people
Very
now
true.
leveraging on telemedical solutions. So as opposed
Hmm.
to going to the hospital or having to queue up and the rest of them, folks are
Hmm.
now looking for avenues where they can just speak with somebody remotely.
Right.
So yeah,
Right. Okay. That's good to know. I mean, technology, leveraging the use of technology, I think is something that we all need to look forward to and continue using it, right?
yeah.
Now coming to the other aspect of being a nurse, what were the unique challenges and I would say even rewards for that matter of being a male nurse? Like, did gender play a role in this, or how is it?
Well, this is the funny one, right? So as a male nurse, I encountered a couple of challenges such as gender stereotypes and other biases, which
Right.
sometimes lead to underestimation of my capabilities. So,
Hmm. Hmm.
especially in regards to nursing, right? Because you
Hmm.
could see I equally struggle with this. I kind of tell somebody that, hey, I'm a nurse, and they're like, no, you are not a nurse, you're a doctor. So they don't
Ah.
believe that I have that capacity
Right.
to be compassionate
Hmm.
or to care,
Hmm.
right?
Hmm.
So, however, these challenges also fueled my determination to excel and to prove my
Hmm.
capabilities, right? So, my
Right.
gender did play a role in my decision to become a nurse, right? As
Right.
I want to break these stereotypes. I equally want to contribute meaningfully to healthcare.
Hmm.
Yeah, so this same drive led me to entrepreneurship, aiming to create
Right.
an impactful solution within the healthcare
Hmm.
sector.
Hmm. because that was my next question. Did that a challenge inspire you to being an entrepreneur?
Yeah.
So apart from this, what other things inspired you to pursue entrepreneurship in the medical field?
Okay. Thank you very much. Thank you. Now, this is a very personal one for me, and
Yeah.
I dare say, a sensitive one, right? So, my inspiration for medical entrepreneurship stemmed from witnessing the gaps and the
Mm,
inefficiency in the healthcare system, such as limited access to quality care and the
mm,
challenges faced by underserved communities. Right. This
right.
observation motivated me to create solutions that could democratize healthcare, making it
Mm,
accessible and affordable to all.
mm. I think accessibility and affordability are the two
Key.
pillars which we should, aim for, so that
Yeah.
everyone can access good healthcare
Hmm.
and at affordable rates. I mean, that is something. It is a basic human need. I mean, right?
Yep.
Yeah,
Yep.
right. So moving on to the next question, in the healthcare system, you already mentioned about identifying gaps, and if you can just specify what exactly were those gaps which inspired for your business idea, if you can elaborate on that.
Okay. Could you take that again? Sorry.
Yeah, you mentioned about identifying gaps, for your business idea, and that is how you went into entrepreneurship in medical field. So if you can specify what were the gaps that you identified.
Okay, okay. Thank you very much.
Yeah.
So, like I said, right, like I did
Hmm.
mention earlier, so these gaps are the gaps in accessibility, right?
Hmm.
And this gap also might not necessarily stand as the gap, but it's an
Hmm.
issue, it's a constraint, and that is affordability. I did mention
Right.
about comprehensive healthcare services, which is trying
Correct.
to trying to bring
Hmm.
closure and limit the gap between
Hmm.
different healthcare sectors. So you can think of the
Hmm.
hospital, you can think of the lab, and you can think
Hmm.
of several other parts, right? So
Right.
these are the things, these are the specific gaps.
Hmm.
However, you have to take this step by
Hmm.
step, brick by brick.
Hmm.
So that the gap, the very gap that I'm looking to,
Hmm.
help in is in the gap that exists within the side of accessibility and affordability. So
Hmm.
now you don't have to break an arm or leg in order to access healthcare. So right
Right.
from the comfort of your home, you can log on
Hmm.
to our platform, right, and
Hmm.
access and pay for a nurse to
Hmm.
come take care of you. Usually, before you
Right.
might have to, maybe go to the hospital, trying to
Hmm.
ask them, hey, do you provide this? No. Now you
Hmm.
just go online and you do this. Now that is
Hmm.
accessibility
Correct.
being
Correct.
taken care of. Now we have the
Hmm.
side of affordability. So you
Hmm.
might even want to consider all the logistics involved in trying to
Hmm.
secure a nurse to come to you. Maybe you have to go to hospital, maybe you have to do this a whole lot. All of those things are removed. Even the operational overheads rather. The operational
Right.
overheads are taken out because now we are leveraging technology to scale
Hmm.
things and to make things easy. So yes, the gap in that exists in accessibility and affordability is now bridged.
Right. Okay. That you're doing an amazing job there, and many congratulations on that. So I really hope you go much further and you will reach more people and more masses with your affordable and accessible healthcare.
Thank you.
So yeah, I want to ask you this question. It's, that how did your nursing experience shape your entrepreneurial journey? I mean, that's I would like to know. That's quite interesting.
Thank you very much. I like to include to that question, how did my nursing experience shape both my entrepreneurial and both my
Hmm.
innovative vision, right? Why am I
Right.
saying this is because it's crucial.
Hmm.
Having to learn software engineering, having to go through the training, I kind of see an error that exists within the technological ecosystem,
Hmm.
which is
mm,
how that there is a whole lot of focus most times on the product over the
mm,
people, if you get what I
right.
mean.
Mm,
So there
mm,
is a whole lot of focus on the technology over the people or over the users. Now,
mm,
coming from my background, my experience has provided me an invaluable insight into the patient's needs because one on
correct.
one I've dealt with them. So I've
Mm,
also have a good understanding in the healthcare delivery challenges and the
mm,
importance of compassionate care. Right. This
mm,
background shaped my entrepreneurial vision by highlighting the needs for innovative solutions that address real world problems and improve the
mm.
patient outcome as well.
Right. I think your background in both nursing and then your software engineering skills, did add up, and I think it's a proper, or rather, I would say, perfect amalgamation to come up with new innovative, solutions for the patient needs. I mean, that's really good to know, and I'm happy that you took up this and you're, scaling this up. So
Thank
I
you.
would like to know, regarding the uh, regulatory environment for healthcare in Nigeria. So
Mhm.
how is it, and how are you, trying to navigate this environment, regulatory environment for businesses?
Wow. Thank you very much. So I'm glad you brought this question up because it's usually the
Hmm.
part that entrepreneurs or aspiring entrepreneurs tend to forget or tend to
Hmm. Hmm.
miss. Right. So
Correct.
for me, navigating the regulatory environment, it involves basically staying informed about current regulations. Staying informed is
Hmm.
very key because policies can change within different
Correct.
governments and within different offices. Also
Hmm.
maintaining compliance with healthcare standards. Now,
Hmm.
this is like a marriage between the external and the internal. The internal being those things that we learned about taking care of patients. We really keeping up with the standards? And also
Correct.
relationship is everything. Fostering relationship with regulatory bodies is key,
Correct.
right? This
Correct.
way you can enter places, this way you can meet people, right? So it's crucial to prioritize patient safety and quality care as well, while we ensure that
Absolutely.
our business practice align with the legal requirements. Yeah.
Hmm. Hmm. Right. When you started off in the entrepreneurial journey, did you have any mentor to guide you, or was it finding your own path? How was it? I mean, I am really intrigued. I want to know about it.
Well, I would say I have a lot of them. And why do I have a lot
Okay.
of them is because I can't say because every situation, especially my own case, is quite unique, right? So, but I do have people, right? So I do have people
Hmm.
that I kind of look up to, especially
Hmm.
because of what they have done, right?
Right.
Especially because of what they have done and the heights they have reached. So yes,
Hmm.
I do have a whole lot of them. Yeah,
Okay.
thank you.
That's nice to know. Yeah. What strategies are you using to build your team? Because this is not a one-man show. I mean, you will definitely need more people in your team to reach more masses and to reach the masses. So, how are you building your team, and you're reaching your target audiences or market? How are you doing that?
Okay. Well, building a strong team involves hiring individuals who share your vision and possess the necessary
Hmm.
skill and expertise. So we
Correct.
focus on continuous training and
Hmm.
fostering collaborative culture. To reach our
Hmm.
target market, we are also leveraging digital marketing options, community
Hmm.
outreach programs, and partnership with
Right.
local healthcare providers to
Hmm.
increase our awareness of our product or
Hmm.
service,
Hmm.
and
Right.
also to give them access.
Right. So you mentioned about training, and I think medical field is something which is changing every single day. And how do you and your team stay abreast with whatever is happening with the latest technology and all that?
Okay, thank you very much. So I would say this requires a whole lot of responsibility, right? In that
mm, mm.
me as I consider myself not just the CEO, I consider myself the chief evangelist, if you get
Right.
what I mean, right? So it's
Right,
also in
right,
my purview to stay updated with the latest trend and stay
right.
updated with the new things happening. So coming from a place of responsibility, it's my responsibility every week to do a search. More like you might
Mm,
want to consider me the R&D of the whole
mm.
the research and development department. So
Correct.
right. So
Mm,
as soon as this is done, because I'm taking responsibility of that office, I go ahead to share with the team. Okay, you might want to check this software, latest software too. And before you know it, we are having sessions where we are training people to, get
mm,
them acquainted with the latest stuff. So I would say, first of all, responsibility, taking
mm,
responsibility for that position, to keep
mm,
in touch with the latest trend, the
mm,
research and development department, and then
mm,
further having time with the team to get them
mm.
acquainted with it. Yeah.
Right, right, right. That's really nice to know. I mean, you being the torchbearer, you are leading from the front, which is amazing.
Yeah.
Yeah, one more thing I want to know is, how are you adapting your business model now that you speak about affordability and all that? So, how are you adapting your business model to the specific economic realities? Because as you mentioned, affordability is a problem.
Yeah. So, well, speaking about our business now, this has a little bit to do with our USP. And when I mean
Hmm.
USP, I mean our unique the unique
Selling
things we are
product.
bringing to the firm,
Yeah, yeah.
right? So our unique selling points and all. So
Hmm.
so we adopt we adopt a
Hmm.
flexible business model, and this
Hmm.
also brings in a flexible payment option, right? So
Hmm.
in all of this, we also leveraging technology to reduce the operational costs,
Hmm.
right? And we
Hmm.
are continuously innovating to provide a cost effective solution, right? So
Hmm.
aside the traditional home healthcare companies that they go ahead and provide standard plans and all of them. Now this is that
Hmm.
USP I'm talking about. We at Mikul Health, we have created an option or a feature where folks
Hmm.
can customize a plan, right?
Right.
So why go ahead and book a standard plan when
Hmm.
maybe 10 out of the 20 services listed in that plan, you are not using them, but then you are paying
Hmm.
for them. How about you just
Right.
have a feature or have an option where you can actually just customize the things that you need and pay for the
Correct.
things that you need? So this is
Absolutely.
what
Hmm.
technology is also bringing to the table. The ability to
Hmm.
do this thing. So you can call it self-service, as it were.
Right.
Yeah.
Right. Right. That's good to know. You pay for what you're doing, and that is what you're uh, doing, and that's amazing. Right. Now, moving to the next question, do you think that since you've been on both sides of the thing, and you've been a nurse and you're an entrepreneur, do you think there are more opportunities for nurses to bridge the gap between patient care and entrepreneurship?
Yeah. Yeah, absolutely. Nurses possess a unique understanding of patient needs and
Mm,
healthcare challenges. So,
right.
this literally positions them well to develop solutions that enhance
Mm,
patient care from a place of understanding. With the right
mm,
support and resources, also, the more nurses
mm,
can transition into entrepreneurship, diving
right.
driving innovation and revolutionizing the healthcare space. Yeah.
Right, right. Now that you have had a success with your medical entrepreneurship, right? So, how do you see that your success story is inspiring other medical entrepreneurs in Nigeria, especially nurses, and if I have to be even more specific, male nurses?
So I want to put a disclaimer, and the disclaimer is
Okay.
that I don't think I've succeeded yet. I'm
Okay.
still in the journey. I'm still in the journey,
Okay.
right? So
Right.
yes, I don't think success is actually a destination as it will. I think it's a journey. So on that
Hmm.
note, I would say well, I hope my journey inspires other aspiring medical entrepreneurs, right? Particularly male nurses, by
Yes.
demonstrating it's possible
Yes.
to bridge the gap between patient care and entrepreneurship.
Hmm.
I
Hmm.
hope that my experiences to,
Hmm.
encourage them and all, right?
Hmm.
So, yeah, thank you.
Right. And I also feel that, you can, I'm sure you would be doing that, that you as a mentor, you can help other budding entrepreneurs and you would be guiding them towards, and definitely, as you mentioned, the background with which the nurses come can definitely
Yeah.
be a very good opportunity to enter into bridging the gap, right?
Yes.
Yeah, yeah.
Yes.
Now
Yes.
let's move towards okay, I wouldn't say successful, I would say a journey in the entrepreneurship. So
Yes.
what
Thank you.
advice yeah, so what advice do you have for the current nurses, who are interested in innovation and who want to think differently and get into entrepreneurship within healthcare? What advice do you have for them?
Thank you. Thank you so much. I think this is a very, very important question. So my advice would be for them to stay curious. Stay curious.
Right.
In other words, stay
Hmm.
hungry, right?
Hmm. Hmm.
Continuously seek knowledge and be resilient. Resilience is
Hmm.
very, very key. That's also
Hmm.
being flexible, So, furthermore, identify gaps in the healthcare system. Leverage your nursing experience or your medical experience. Now innovate
Hmm.
and bring solutions that are actually novel, or
Hmm.
perhaps solutions that are being built on the improvement of existing solutions, right?
Hmm.
And
Hmm.
lastly, don't be afraid to take risk, right?
Right.
And
Hmm.
I would say surround yourself with supportive network and always prioritize patient care in
Hmm.
everything. Patient care first. Patient care first. Now, I'm gonna say this like I will say this like a very, very important tip, which is know why you want to do this. Why do you want
Correct.
to do entrepreneurship? Why is very,
Hmm.
very important, because there will be
Hmm.
days when without your why on site, you will
Hmm.
not be encouraged to even show up. Do you
Hmm.
get? Because should you want to do this because of money? I
Hmm.
there are different ways you can get money really. Should I
Hmm.
even want to do this, right? Because of money, I won't be here anymore, because the money, they are not far coming as you might expect it. So
Hmm.
you have to really, really make sure that your why is valid and it is
Hmm.
selfless. Don't have a
Hmm.
selfish why. If not, you would be lost. Like you won't even continue. You won't even be
Right.
motivated to continue. You will lose the zeal and the
Hmm.
passion, I dare say. So
Hmm.
yeah, why is very, very key. Knowing your why
Hmm.
is very, very key, because also this terrain will not favor those who are suckers of instant gratification, because there's
Hmm.
there's no instant gratification in entrepreneurship.
Correct. Hmm.
So
Hmm.
if you're here and you just want to start making big money, you want your company to be a unicorn within a
Hmm.
year or two, you are you are in for a
Hmm.
root shock. Yeah.
Right. Okay, that's really good to know. That's a great piece of advice for all people who want to get into healthcare entrepreneurship. So, as I mentioned before, also, I mean, do you see yourself mentoring, future generations of nurses or entrepreneurs in the medical field?
Yeah, sure. Yes, I'm passionate about
Okay,
mentoring future generations of nurses, most especially, and of course, entrepreneurs. So, sharing
right.
my knowledge and experience, I believe, can guide and inspire others to pursue their goals and
Hmm.
contribute to advancing healthcare. So, yes, I'm
Right.
open for mentorship.
Right, right. So, on the same note, I would also like to add, I would also like to ask, how important do you think is networking for nurses? and even for entrepreneurs in the medical field? How important is it according to you?
Oh, okay. Uh, it's quite important because I like to think that the future of healthcare, and not just
Hmm,
healthcare, and the
hmm,
future of anything entrepreneurship is actually in partnership,
hmm.
if you get what I mean. And there's no
Correct.
way you can aim to partner with people if you don't network with them,
Hmm,
right? So you want to make sure that you are in a group of like-minded people who share
hmm, hmm.
same vision, same
Correct.
passion, same
Hmm,
skill, and the
hmm,
same career path. Partnership
hmm,
is everything. You
hmm,
can't build alone, and even if you build
hmm,
alone, you will not use that product. Everything,
hmm.
honestly, is everything,
Right.
because at the end of the day, why are we
Hmm,
doing this? Going back to the
hmm,
why again, why are you
hmm.
doing this? Right.
Correct.
So
Hmm,
the more you identify your why, the more you
hmm,
see how other
hmm,
people play a part in that why. So
hmm.
yes, networking is key through partnership.
Right. Right. Okay. Okay. So here I would like to ask, what are your thoughts about the future of nursing?
Mm,
Where do you see nursing, in a few decades? I mean, what innovations do you expect or something like that, if you would want to share with us?
wow. You know, I would like to answer this question in view of the AI boom,
Right. Huh.
if you get what I mean, because there's
Yes,
been a
yes.
lot of debates. There's been a lot of
Hmm.
debates about
Hmm.
AI, robotics replacing a whole
Correct.
lot of things. Well,
Hmm.
if you
Hmm.
remember in one of my answer, I mentioned that one of the ways or the major way nurses or healthcare professionals could position themselves for relevance in the
Hmm.
advancement of technology is in the
Correct.
place of merging technical skills and emotional intelligence.
Hmm.
Now, the marriage of these two is very, very key, because in the future, even in the advancement of AI, in the advancement
Hmm.
of robotics, there is
Hmm.
no place for them to replace emotional intelligence.
Absolutely.
There is no place for them to replace compassion or
Correct.
even replace empathy. Yes,
Empathy. Correct. Hmm.
they might have it with the technical skills, have it with the
Hmm.
technicalities, but not
Hmm.
with these things, because these things
Correct.
has more to do with a soul. It has more
Hmm.
to do with a spirit. It has more to do with humans. So
Hmm.
yes, the future of nursing is promising. So with
Right.
increased opportunity for specialization as well and
Hmm.
leadership roles, right? So entrepreneurship can play a crucial role. It's by
Hmm.
driving innovation as well, improving
Hmm.
healthcare delivery, and addressing
Hmm.
unmet needs. So nurses who embrace entrepreneurship can lead the way
Hmm.
in creating transformative solutions that enhance
Right.
patient care and overall
Hmm.
healthcare outcomes.
Right.
Yes.
Right. I think definitely I can agree to this part. When you mentioned that, uh, you know, uh, this entrepreneurship, uh, and nursing in for that matter, in nursing and in medical field, the human touch will always be there. I mean, no matter
Yeah.
how technology advances, but still that human touch is something that the compassion, the empathy, I think, is definitely going to be there, and that cannot be replaced, no matter
Yes.
what. Right.
Mm-hmm.
So it has been an amazing session talking with you, Mr. Michael Joshua, and I really appreciate you taking out your time and talking to us. And I'm very sure that your journey in entrepreneurship has inspired a lot of youngsters and people who are looking to get into medical entrepreneurship. And thank you for being with us today. And with this, we are wrapping up the session.
Thank you very much, Dr. Anjana. It's my pleasure. I'm really honored to be here with you guys to speak to your community and
Yeah,
also to share my perspective about the whole thing: nursing, healthcare, technology, and entrepreneurship. Thank you. I
right.
appreciate it.
Yeah. Thank you. Have a good day.
Thank you. Cheers.